should say to your kids, I expect you not to engage in drinking outside the home because it's dangerous and it's bad for your health. Doctors need to give young people the same message. We have emerging evidence from scientific studies that it's very powerful when doctors just make simple statements like that. I think the time to start talking to kids about tobacco, alcohol, and drugs is around age 9. Whenever your child is going to transition from elementary school to middle school, because that's a big transition. There's very little substance use of any kind in elementary school. But once you get to middle school, you have 6th, 7th, and 8th grade, and by the 8th graders are starting. So that means when your kids go from grade 5 to 6, now they're going to be exposed. It may just be to smoking, but they may, encounter one of the older kids in the school, who started to drink or even, use a drug. So I would have the conversation before they go there, and because we should do the conversation in a developmentally appropriate way, I would say, do you know what tobacco is? Do you know what cigarettes are? Yeah, well, tell me, what do you know? Well, there are things people smoke. And do you know anyone that, any of your friends tried it? No. So what do you think? Is it good? Is it bad? Oh, no, they told us in school it's bad for your health. It's like a drug. Oh, okay. Well, I just raised the issue because, next year you're going to be in the middle school and you might see kids who are smoking, and I would never want to think you'd be engaged in that. So that's the way to discuss it. And the same thing for alcohol. You know what an alcoholic drink is, beer, whiskey, and, and listen. Listen to what they know and what they think. And then very basic information. I hope you won't get involved in that. You can always come and talk to me if you have questions. And the same with drugs. So then at least you have an idea about what they know, what they've already seen, and you've kind of primed them for the conversation. So one of the phenomena here is something I call bookmarking. So what children do is, if you do this in a way that's non-judgmental and non-threatening, they kind of put a bookmark in. Okay, well, if I ever need to know about that, I guess maybe I could talk to mom or dad. And the same is true with the doctors. That if the doctor does this right, they kind of bookmark it and say, okay, well, if I ever need to know, I'll ask Dr. Smith. So I think that's a healthy way to do it. And then as kids get older, you have to talk about some of the more difficult aspects. One of the big transitions is when they get old enough for a driver's license, because the thing that distresses me the most is the risk of death. The leading causes of death among young people in the United States are accidents, homicides, and suicides. And the largest category are car crashes. And a large proportion of car crashes are associated with alcohol use and drug use. So that's like a leading public health problem in adolescent health. So you really have to address this head on, and you have to have frank discussions about the risks of driving a car after drinking or getting in a car with someone else who has.